Arun Sethi. He's going to speak on reaching the unreached. He's a senior consultant and the director of Deseret Eye Hospital and a very well-known figure all over India. Over to you, sir.
We have very interesting talks and wouldn't like to stop anyone in between, but requesting everyone to please adhere to time limit so that we can finish in time.
Yes. Yeah, I think we have 7 minutes per talk. Yes, sir.
So I'm Dr. Arun Sethi. Thank you very much. Slides kar dijiyega. So the two topics that were given, one is reaching the unreached. So this is a little story about how we as private practitioners with a background studying out of Christian Medical College and Arvind Eye Hospital started our own little trust to create an image. So this was started in 1990 and we saw our first patient under a tree when we had the American team visit us, and this was in a village near Delhi. And as you can see that we formed only 4 basic objectives. One was to reverse the tide of avoidable blindness, increase eye care awareness in the society where we were working, knowledge and skill transfer amongst our colleagues, and to provide comprehensive eye care because we found there was too much of emphasis in community work only on cataracts. So we designed the eye care project in such a way that before we could build a hospital, we had a village outreach program. We started a school screening program. We had developed 2 vision centers, one in New Delhi, one in Gurgaon, and we had a mobile active ophthalmic unit. Then came up our base hospital, which had a comprehensive eye care and the super specialty clinics, ophthalmic surgeries, and tertiary eye care. So in the pre-COVID area, we used to go out into the village outreach programs and, we would do these activities, including awareness building, training of the local volunteers who would then go and screen the patients before we came to be able to save time, conducting comprehensive. So we were taking glaucoma, retinal diseases, everything into the consideration and providing either free or low-cost glasses wherever it was possible. So as you can see, this is how we used to run those camps. And these are the diagrams of the villages that we were reaching out through various CSR projects, which were sporadic and few, mostly in Gurugram district, where we have now covered quite a few. Then we started the Netra Jyoti Abhiyan. Now this is the program we are doing with the Gurgaon administration to remove the backlog of cataracts in rural Gurgaon. And our vans are going everywhere, screening them, bringing the patients back where they require surgery. Then another very interesting concept that came up was the school screening program. Here we got a grant from a corporate social responsibility project, and we have the largest series of about 72,000 rural children in Gurgaon district under a project called They See, They Learn. So we used to go in, train the teachers who would screen the students through the e-charts, and then we would go in and screen them again and find out the false positives, and those who required refractive errors, provide them glasses, including the staff. But as per the rules of the government, none of them were undergoing cycloplegic retinoscopy. Those who required the same were referred to our base hospital. So you can see those findings in it. So then we have satellite clinics, 2 of them only. We are starting to see how long they'll take to become viable and the kind of patients who are coming in and getting screened, and we are seeing them over there. Then we are working with primary health centers where our teams are going on a weekly, monthly or tri-monthly basis to provide eye care services when they're not available. So we already worked in 12 primary health centers across Gurugram district, and we're working closely now with the Gurugram district chief medical officers to provide the same. The post-COVID area was an interesting one that suddenly, masks came in, social distancing came in, we could not have assembly of large number of patients. So we started doing a different program, and as you can see, the vision centers were redesigned to keep space between the patients and to be able to see them. Now that is our base hospital. And the base hospital was designed in the United States, and we now have a cross-subsidy model where 1 floor is dedicated to bringing in patients from camps and treating them. 1 floor has subsidized eye care services, and 2 floors are for paying patients who pay, and there's a cross-subsidy model. So that's the look of our private wing, our optical shops, our consulting rooms, our super specialty wing that has been created for diabetic retinopathy, pediatric ophthalmology, vitreoretina, and glaucoma. So we have the idea is to provide an aesthetic working environment so the doctors feel involved as part of the mission to reach out to the unreached. So as you can see that we have our own scrub rooms, operation theaters, and we provide all the services. So we work with a lot of international organizations over the years, and that is Senator Mitt Romney, who's on our board. He was here from the United States a few years ago. He ran for the presidency of America against Obama and lost. So we have done around 17 lakh patients now, more than 53,000 cataracts, a total about 80,000 procedures we have done. We've given away 95,000 pairs of glasses. So many patients receive free eye medicines. So our philosophy is that the only thing that is worse than being blind is having sight but no vision. So it's important that we should be able to do our practice as well as do community work together. Thank you very much. So there's a second presentation also, which is just 3 minutes.
Actually, you have two presentations.
Just 3 minutes, I'll finish that because they transferred it to this hall.
In this, there is only one presentation.
Actually, the other one that they've given me, I've got to. I'll just take 2 minutes.
Okay, sir. Okay.
So, वो लगा दीजिएगा जरा. Because the new system which they had was different from the book system, so there was some confusion. So this is how you manage a modern ophthalmic facility, the pearls and pitfalls. So as we were discussing in the previous case, that is very important to have an efficient environment for a modern facility in terms of your staff, patients, and ophthalmologists. So please analyze the goal and expectations of each. If you don't do that, you'll never have a successful practice. In human resources, you'll have to do train staff, technical skilling, upskilling them, task to skill matching, continuing medical education. Now, managing staff performance and efficiency is very important. As you can see, it's important to train your staff. Now, what is the purpose of training? To render better quality services to patients, promoting safety measures. Safety measures are very important because if you don't do them, you're likely to injure the patient unintentionally. Keep an appointment system that is efficiently seeing patients, doctors' time, use HMS and EMR systems. Then the EMR system is integrated information technology. So we use one which is quite effective for our hospital. Then what are the benefits? So if you use modern techniques like this, you reduce the cost and increase the efficiency of the facility. This replaces paper patient medical record become less, and you have paperless records, and you can seamlessly transfer them from one center to the other. In terms of marketing, it's very important to establish and maintain customer relationships because your profitability will depend on holding on to the patients you have and finding new patients where possible. So always have good quality eye equipment that you can be comfortable with and provides accurate information. And managing the equipment is also very important. Your frequent breakdowns, cost of maintenance should not go up. And the other thing is that some of the pearls and pitfalls is how you interpret also your findings, because the goal is to balance your capital investment for equipment with the real benefit to patients and increase patient uptake. Now, if you're running an eye hospital with just cataracts or refractive error problem is in the metro city, you won't survive. It's very important that you have super specialty clinics and good trained super specialists to augment your system. So in conclusion, a modern ophthalmic facility is a service industry with very high expectations of the patients from the physician. Ophthalmologists control major part of the clinical surgical efficiency, and concern and passion for the profession is very important, so don't forget the poor. Thank you very much.
Thank you very much, sir. Dr. Arun Sethi. You have really covered the topic exhaustively, reaching the unreached. It was a fantastic presentation. So also the second one, back to back. Thanks a lot for being part of this very important